In the fascinating world of medicine, there are diseases so strange and mysterious that they baffle even the most skeptical people. Today we will explore what these diseases are, and as today, some of them remain a mystery to scientists. Let's begin. Number 10. The ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, is a progressive and degenerative neuromuscular disease that affects the nerve cells responsible for the control of voluntary muscles. As these cells become damaged and die, the muscles weaken and a progressive loss of muscle function occurs. It is estimated that there are between 3 and 7 people with ALS per 100,000 inhabitants. Symptoms of ALS can include muscle weakness, spasms, difficulty speaking, swallowing, and breathing. As the disease progresses, it can lead to paralysis and loss of ability to perform daily activities. Life expectancy varies, but on average, after diagnosis, people with ALS typically live 2 to 5 years. One of the most notorious cases in the world was that of the famous physicist Stephen Hawking, who unfortunately lived with this disease until his last days. Currently, there is no cure for ALS, but there are treatments that can help manage symptoms, improve quality of life, and provide comprehensive care and support to patients. Number 9. The Siamese twins. While it is true that it is more of a disorder than a disease, the condition of conjoined twins occurs when two individuals share physically joined body structures at the time of birth. This situation is due to an incomplete division of an embryo into two separate individuals during early development in the womb. The exact prevalence of conjoined twins in the world is extremely low and varies significantly. It is estimated to occur in approximately 1 in every 200,000 births, but it is important to note that this figure can vary depending on specific regions and populations. The way conjoined twins are joined can vary widely, from simple unions in specific areas of the body, to more complex unions involving shared internal organs. Each case is unique and requires an individualized medical approach. Number 8. Morgellons syndrome is a poorly understood and extremely rare condition, in which people experience the sensation of having foreign fibers or particles under the skin. It is characterized by persistent skin lesions, intense itching, and the presence of unusual fibers that appear to grow from the skin. The exact prevalence of Morgellons syndrome is unknown and has been the subject of debate, with some doctors and scientists considering the symptoms to be related to psychiatric disorders, while others suggest there may be an actual physical component, such as an inflammatory reaction or an infection. There are no precise figures on how many people have this condition in the world. Some estimates suggest that it affects less than 1 in 10,000 people, but these figures are approximate and may vary. To date, there is no scientific consensus on the exact cause of Morgellons syndrome or its treatment. Number 7. Butterfly skin syndrome, also known as epidermolysis bullosa, is a rare genetic disease that affects the skin, making it extremely fragile and prone to the formation of blisters and wounds. This condition is due to the lack or dysfunction of certain proteins that bind the layers of the skin together. Butterfly skin syndrome affects around 1 in every 50,000 live births worldwide. The severity of the disease varies widely, from mild forms with occasional blisters to severe forms in which blisters and sores are constant and can cause serious complications. There is no cure for butterfly skin syndrome at present. Treatment focuses on managing symptoms and preventing complications. This involves daily skin care to prevent blisters and ulcers, administering medications to pain management and physical therapy to maintain mobility and prevent deformities. Number 6. Epidermodysplasia verruciformis, also known as tree man disease, is an extremely rare genetic disease, which affects the skin and the body's ability to fight certain types of human papillomavirus. It is characterized by the appearance of flat, scaly warts on the skin, especially in areas exposed to the sun. The exact prevalence of epidermodysplasia verruciformis in the world is unknown, however, it is estimated that it affects less than 1 in 1 million people. It is an inherited disease, and mutations in immune system-related genes, such as EVER1 and EVER2, have been found to be associated with this condition. Epidermodysplasia verruciformis may increase the risk of developing skin cancer, especially the squamous cell carcinoma type. Treatment focuses on symptom management and skin cancer prevention through sun protection measures and regular surveillance for suspicious lesions. Number 5. Stone Man syndrome, also known as fibrodysplasia ossificans progressiva, is a very rare genetic disease that causes the progressive formation of bone tissue in muscles, tendons, and ligaments. This abnormal bone growth can lead to joint immobility and cause a condition known as mass ossification. The exact prevalence of Stone Man syndrome is unknown, but it is estimated that it affects approximately 1 in 2 million people worldwide. It is an extremely rare disease and only around 800 confirmed cases have been recorded worldwide. FOP is a progressive condition and has no cure. Treatments focus on managing symptoms and preventing the progression of ossification. Number 4. Buschke-Ollendorff tough skin syndrome is a rare genetic disease characterized by the presence of abnormally rigid skin and the formation of plaques or bone lesions on the skin. The exact prevalence of this syndrome is unknown. It is caused by mutations in a gene called LEMD3, but it is considered extremely rare. To date, only about 100 cases have been reported worldwide. Due to its rarity, there is no precise estimate of how many people have this condition. It is estimated to occur in less than 1 in a million people. Buschke-Ollendorff tough skin syndrome can manifest from childhood to adulthood, and its symptoms can vary widely in each affected individual. In addition to skin rigidity, bone plaques can appear in different parts of the body. Number 3. Congenital hypertrichosis syndrome, also known as werewolf syndrome, is a very rare genetic disease characterized by excessive hair growth all over the body. This condition is usually present from birth and is due to a genetic alteration. The exact prevalence of congenital hypertrichosis syndrome is unknown, but it is estimated that it affects less than 100 people worldwide. Given its exceptionally rare nature, it is estimated that it occurs in 1 in every 1 million people. It is important to note that there are different forms of congenital hypertrichosis, some of which are milder and others more severe. This condition can affect both men and women and is not transmitted hereditarily. In most cases, treatment focuses on symptom management and multidisciplinary medical care to address the aesthetic and health concerns associated with excessive hair growth. Number 2. The progeria, also known as Hutchinson-Gilford syndrome, is an extremely rare and progressive genetic disease that causes premature aging in children. It is characterized by slow growth, fragile appearance, hair loss, wrinkled skin, and health problems related to aging. The prevalence of progeria is very low, affecting approximately 1 in 20 million newborns. Worldwide, it is estimated that there are between 350 and 400 known cases of progeria. Importantly, the disease is not related to the age of the parents or their ethnic origin. Progeria is caused by a spontaneous genetic mutation that affects the LMNA gene. This mutation affects the structure of the protein called lumen A, which is important for the integrity of the cell nucleus. As a result, patients with progeria suffer accelerated aging. Number 1. Proteus syndrome is an extremely rare genetic disease, which causes excessive and uneven growth of tissues in the body. This condition can cause deformities and overgrowth of bones, skin, and other tissues. Proteus syndrome was first recognized in the 1970s and owes its name to the Greek god Proteus. It is characterized by its wide variability in the form and severity of symptoms, which makes its diagnosis difficult. To date, It is estimated that fewer than 200 people worldwide have been diagnosed with Proteus syndrome. The disease is caused by a spontaneous genetic mutation and is not inherited from parents. Treatment for Proteus syndrome requires a multidisciplinary approach. The interventions used to control the overgrowth of long bones are epiphysiostosis, epiphysiotosis, and in extreme cases amputation. If you liked the video, please like and subscribe to the channel, so we can bring you more of history's finest tops from around the world.